Honorable Minister and dignitaries, we now present a brief overview of the computerized patient management system installed at AIIMS Jodhpur. The first step for all patients is registration. The form being used at AIIMS Jodhpur has been issued by the Ministry of Health and Family Welfare, Government of India, and records patient demographic information in great detail. For continuity, registration is done only once in the person's lifetime, and all their medical information is linked to the barcoded registration card. Once registered, the patient can avail the services of the institution like OPD consultation. OPD tickets can be printed for any consultant of any department. Duplicate tickets can be issued in case of loss. Through their OPD panel, doctors record the patient's diagnosis and clinical details, which leads to standardization of the recorded information. All the investigations being performed in the institution are also ordered through the doctor's OPD panel and medication prescribed to the patient as required. All of this information is stored in the electronic medical record in chronological order to be accessed subsequently by authorized users. Ordering of investigations and prescription of drugs takes place through only a few mouse clicks. This information is automatically transmitted to the investigating department or the pharmacy as the case may be. Inpatient admission is processed through the central ward administration. All the admission related information such as date of admission, expected date of discharge, etc. are accessible at the central admissions counter. Bed occupancy of the entire hospital is displayed in the form of ward charts showing empty and occupied beds. The name of the patient, their doctor and diagnosis are also displayed on the occupied bed. In addition, all clinicians have access to their on-bed list, which gives additional information helpful for patient management. The previous OPD visits can be seen, and most importantly, the red flag of the adverse substance reaction previously experienced by the patient. This information is vital for preventing accidental wrong prescription. All types of forensic documents related to medico-legal aspects of the patients are also present in the electronic record. For example, the injury report form, which is seen here. Hospital services like biomedical waste and CSSD are also managed through the CPMS. Each surgeon has the facility for creating dedicated instrument sets for different operative procedures. This information is stored in the CSSD panel, and when that operation is scheduled, the appropriate instrument set is dispatched. Listing of patients for surgery is also done through the same software. Most importantly, these lists are visible to all the personnel associated with that procedure, so that availability of blood from the blood bank, anesthesia fitness, and availability of ICU beds, etc. is displayed on the operating list itself. The CPMS also supports online patient referral, which requires only a few mouse clicks for selecting the department and doctor. All the patient information in the electronic medical record is automatically transferred to the second doctor by the software, and a reference calendar keeps a record of sent and received references. In the electronic medical record, the patient's name is a link to the complete information from which previous investigations, drug prescription, and other treatment can be accessed by the authorized user. Honorable Minister and dignitaries, apart from these, the CPMS has two unique features currently not found in any hospital information system. The first is a real-time display of the inventory of the institution's blood bank in accordance with the directions of the Ministry of Health and Family Welfare, Government of India. This chart, accessed through the AIIMS website, displays the minute-to-minute status of blood product availability. There is also a facility of ordering the blood products online through an online form, and a contact helpline has been given in case of difficulty. The other unique feature is the management of imaging investigations by the software, which uses the principle of vendor neutral archiving, the latest concept ahead of the PACS system. In VNA, the images remain attached to the patient's medical record in the original non-proprietary format and can be readily transmitted to other authorized users in the same hospital or different hospitals anywhere in the world. This can be done without any change or modification. AIIMS Jodhpur is possibly the first institution in the country to use this latest technology. I thank you all very much for your kind attention.